Good afternoon. And today we have a pleasure to interview in our studio Director of Clinical Relationship of the company who provide daytime treatment for obstructive sleep apnea. Welcome, Lori.
Thank you, Dr. Sokolina. Happy to be here.
And thank you very much for our audience. If you suffer from bad sleep or sleep next to the snoring partner, please click the like and share button. This way you can help us to spread the word about our channel. If you are a medical professional, we really encourage you to use our channel as a virtual networking ground in collaboration with other medical professionals, because only together we can find all missing puzzle and be able to solve the problem with the diagnosis and treatment of obstructive sleep apnea. So I'm going to start with introduction, Lori, and introduction in general concept of eXciteOSA.
Okay.
First time I heard about eXciteOSA on a conference. It was Well Cornell ENT sleep apnea or ENT sleep conference maybe 3 years ago. And director of American Academy of Dental Sleep Medicine mentioned to me about the device which patient can use during the daytime before the night, and it would work on a tongue, and patient would stop snoring. I got very excited, and the name of it, eXciteOSA, so I was excited about that. And I thought, oh, that's so great, because tongue actually, I learned it from the book, from scientific research, is responsible for 70% of obstruction for obstructive sleep apnea. But from my clinical experience over 15 years, I noticed working with the patients with obstructive sleep apnea, they are not connected with the tongue. And in a literally world, they have a hard time to move the tongue, and tongue have a very special shape. It's quite big, and it has a scalloped indentation of the teeth on the borders. So tongue is the obstructor. Tongue is really guilty for obstructive sleep apnea episodes. And I was very happy to learn what this device now is on the market for 2 years. It's FDA approved. And now we're going to learn together what we can do to treat the symptoms of obstructive sleep apnea during the day and not to experience it at night. And again, I'm very proud to say about Lori, who has a lot of experience in a sleep world. She was a respiratory therapist for more than 30 years, and she worked a lot with sleep technicians in a sleep lab to explain to them how to make CPAP machine more user-friendly, more comfortable for the patient. So welcome, Lori, again.
Thank you.
And my first question to you would be, please tell us about this magical device.
Okay. eXciteOSA is made by Signifier Medical Technologies, a company that was founded in London about 7+ years ago. The founders of the company are a neurosurgeon, acupuncturopathy, and then an ENT surgeon, Dr. Anshul Sama. They had a vision for this therapy based on the other applications of neuromuscular electrical stimulation that have been used for decades. That involves using a gentle electrical current to stimulate muscle. And this was commonly used in the rehabilitative medicine arena. They thought, well, if you can rehabilitate skeletal muscle using gentle neuromuscular electrical stimulation, can we apply that principle to the tongue? Because as you mentioned, many people who have obstructive sleep apnea have poorly responsive tongue muscles. Particularly the genioglossus muscle. In our mouth, we have large muscles that help to control the tongue, keep it out of the way of the back of the throat. We have intrinsic tongue muscles, which are responsible for shaping the tongue. And then we have extrinsic tongue muscles that arise from other structures in the head and neck area that insert into the tongue and are responsible for moving the tongue. The largest of these muscles is the genioglossus, which is a fan-shaped muscle that originates from behind the mandible and extends into the body of the tongue on either side of the tongue. That muscle, when it doesn't work properly, will allow the tongue to collapse into the back of the throat during sleep when someone has obstructive sleep apnea. So our goal is to rehabilitate and tone that genioglossus muscle.
That's, talking about muscle of the tongue, it might seem boring to somebody, but not to me. We always work with the tongue muscles during myofunctional therapy, trying to make that muscle stronger. And I would like to know specifically, how does it work? How this device work on a muscle? What exactly happened? What tongue becomes so responsive? That's exactly the same goal we're trying to accomplish during myofunctional therapy. But sometimes, you have to do the exercise 3 times a day, and sometimes the time limitation, or people get tired, lose encouragement. This is kind of a different approach and make me very hopeful. So tell me, what exactly happened with the tongue muscles, maybe with the muscles fibers, or maybe with the muscle what opened the airway, which also connected with the tongue.
Right. So the gentle neuromuscular electrical stimulation is provided by the mouthpiece. And if I hold this up, you can see that there are 4 dark surfaces. Those are pads that contact the tongue. And using the app, and I'll explain the method in a moment, but using the app, the user is able to adjust the amount of stimulation that they're delivering to the tongue. We hypothesize that applying neuromuscular electrical stimulation to the tongue muscle actually depolarizes the muscle and makes it twitch or contract, which tones it. In our bodies, we have skeletal muscle all over in different areas. The tongue is really no different. The types of muscle fibers that we're trying to change are the skeletal muscle fibers in the genioglossus. Many people who have obstructive sleep apnea have a higher proportion of fast twitch, low endurance muscle fibers than high endurance, low twitch muscle fibers. So if you think about, say, for instance, a marathon runner, right? Somebody that has to run a long distance, picture their body type. Typically, they're long and lean. They're not bulky and pumped up. Those athletes have a large proportion of slow twitch, high endurance muscle fibers. Contrast that to a sprinter. A sprinter may be a little bit more stocky, have more defined thigh muscles, and they're built for fast bursts of energy, a very strong, fast bursts of energy. But rather than 26 miles, they're going to stop at 500 meters. Right? So what we're aiming to do is to tone that tongue muscle, not make it bigger, not necessarily even make it stronger, not certainly to change its shape or size, but just restore the muscle tone that was originally there so that that genioglossus can perform appropriately and stay out of the back of the throat during sleep and prevent apneas from happening.
I absolutely like your comparison with the marathon, because that's how I look at the sleep apnea therapy. Yes, we're preparing the patient to run the marathon, not how they run it now with obstructive event and elevated high blood pressure and heart rate, but actually to run slow, steady marathon, just the tongue out of the airway. And of course, for that, tongue have to have a little bit different endurance. And, I like how you compare with the lean, strong marathon runner. That's our goal with the active myofunctional therapy and with eXciteOSA as well. And I would like to ask you a little bit more technical, how this wonderful component work, technically, how it make it stimulate the patient, how a patient can do the therapy in the comfort of their home, what exactly they need to do. And
right. So the first thing that has to happen is you need to have a prescription. This is a Class 2 medical device. It's authorized by the FDA, needs to be used under the supervision of a medical professional. Once that prescription is written, we have distributors that the patient can either purchase the device from, or they can try to get insurance to pay for it. They may not be successful. There's not broad coverage just yet, but we do have some insurance companies that are paying. Once they receive eXciteOSA, it comes in a small box like this. And the components in the box are the mouthpiece that I showed you before, as well as the control unit. So this is the brains behind the operation, if you will, and then a charging cable. So there is a small battery in this that must be charged, but once it's charged, you should get a whole week's worth of therapy, or roughly a week of therapy from it. The other component is a smartphone app. Anyone can download eXciteOSA from either the App Store or Google Play. And even if you don't want to use eXciteOSA and you're just curious about the app, you can learn a lot about sleep apnea right through the app. There are a lot of good educational features of the app. Once that app is downloaded, you must have Bluetooth turned on the phone, and you connect the mouthpiece to the control unit, and the app will find it. When you are onboarding into the app, it'll ask you a few questions about your name, your date of birth, etc. You'll receive a 6-digit code, which you will then use to access therapy. Once you're activated, you use the device once a day for 20 minutes. And what will happen is once you start a session, a timer will count backwards from 20 minutes. So you don't have to set your clock or worry about turning it off or anything like that. It's all very automatic. Additionally, there is an onboarding video which will explain how to use eXciteOSA, how to keep it clean, how to keep it neat and everything like that. And you'll use it every day for 6 weeks for that 20 minutes. Anecdotally, we do hear users saying that after 4 weeks or so, they have less snoring. This is especially helpful if there's a bed partner that's listening to the snoring. But we do expect you to use it for the full 6 weeks before you have a repeat sleep study to see if you've improved your therapy. Again, the app's super user-friendly. Once you're using therapy, you can adjust the amount of stimulation that you're delivering to the tongue. When you first begin, it's going to feel like your tongue is twitching, kind of like a muscle twitch, if you will. And then you can increase that stimulation level over that first 6 weeks, but it's completely controlled by the user.
Yeah, thank you very much. You actually answer. Thank you very much to our audience. And we have a wonderful question, but I think Lori answered that question. To see the result according to the company direction, it has to be 6 weeks, 20 minutes a day. But some results show it can happen much sooner than that. I have a question. Usually people ask me, is that painful?
No, it's not painful. Now, none of us are used to putting anything in our mouth for 20 minutes, so it's a little bit different, but it doesn't cause pain. It's basically a flex of your muscle or contraction of your muscle. It's a different sensation, but if you start using it and you start at a low level of stimulation and stay there for a few days and then gradually increase it, it's a pretty seamless process to get through that first 6 weeks. If you were to turn the stimulation up as high as you could go, initially it might be a little uncomfortable, but we don't recommend that. We recommend that you start at a lower level and then gradually build your tolerance to it.
Yeah, thank you very much. And again, for our audience, if you have any questions, please put them in the chat box and we would be very excited to ask Lori about that. But I would like to ask you, who is not qualified user? I understand it's up to the discretion of the doctor, but again, I want our audience to know, certain things, they can be addressed and person can become a qualified user, but what's your or company opinion about who is not?
So there are some contraindications to eXciteOSA. Having an implanted electrode of any type, like a defibrillator or a pacemaker would be one, being less than 18 years of age, having an apnea-hypopnea index higher than 15, having any type of open sore or ulcer in the mouth would be a contraindication, and being pregnant. We did not test it with pregnant women. So it's going to be for patients who have primary snoring or mild sleep apnea at this point.
We have another listener with a question. Do you recommend to use device for the rest of the life or just for 6 weeks?
That's an excellent question. So thank you for asking that question. We recommend that you use the device daily for 6 weeks. And then after the 6 weeks, there is a maintenance phase. And the maintenance phase is twice per week minimum. So in other words, use it every day for 6 weeks. And then after that, graduate to twice a week. Some people will want to use it more. Some people will want to use it less. As it pertains to the long term, we have just completed and are analyzing a clinical study that looks at what happens during a 12-month duration of time. So we'll have more information coming out as that data becomes available. But for right now, it should be looked at as a lifelong exercise.
Oh, so that's the great answer. Now it's very clear. My question to you: what happened if device not gonna work? Like I recommend it to somebody to use, but they complain to me. No, I use your recommendation, but device, I still snore. What happened? What's the company policy on that?
Yeah, so we do have a return policy for our product. It's important to note that sleep is very subjective, and our perception of sleep and how much rest we're getting is not always actually correct. Sometimes people sleep for 8 hours and they're not sleeping very well, but they think they've slept very well. Really, the best way to determine whether or not it's working is to have that sleep study so that you can look objectively at proof of if you're improving or not. So again, we are indicated for primary snoring and mild sleep apnea. In our clinical trials, 90% of the participants had a decrease in snore time. The average reduction in snore time was 46%. So almost cut snore time in half. So will it completely stop your snoring? In our trials, it didn't for most patients, but anecdotally, sometimes it does for the majority. So it really depends. It's an individual experience. As far as the apnea hypopnea indices go, in our clinical trial, there was a 52% reduction in the apnea hypopnea index and a 50% reduction in the oxygen desaturation index. If after 6 weeks' time, there's dissatisfaction, it's not working, and there are many contributing factors to obstructive sleep apnea, so it may not work for everyone. We will refund your money within 8 weeks, but we have to be sure that you were using it and it just didn't sit on your dresser for 8 weeks. So we want you, if you invest in this product, we really want you to try it and use it as recommended. But at the end of the period, if you're not satisfied, we can refund your money.
My question to you about, I want to kind of summarize what you said. And I think it's very important, like in any therapy, we want to have objective data. In a sleep study, for me, it's objective data. And I know that if I prescribe this device, I want to see results on a sleep study. I know some people really fight hard and they don't want to do that, but I agree with you. Before returning the device, I want, as a provider, want to see the objective data. So I really support what you just said. And I want to ask the comparison of that device because it's a neuromuscular stimulation. What's so different between eXciteOSA and Inspire therapy?
Right. So the goal of Inspire therapy is to stimulate the hypoglossal nerve to protrude the tongue. So when a person breathes, there is a sensor that will then deliver that stimulation to the hypoglossal nerve and protrude the tongue so that they make some room in the airway and don't experience the apnea. Our mechanism of action is to restore the muscle tone to the tongue so that it can function naturally in the way it was designed to function. So another thing that makes the two therapies different, Inspire is indicated for moderate and severe sleep apnea, where we are indicated for mild sleep apnea and primary snoring.
So basically, like together, you address the whole spectrum of a sleep apnea. We have Another question from our listener: is a prescription should be only from MD, or it can be good from the dentist?
That's a question that really depends upon what state you live in. I would suggest that you check with your dental board. Most state dental boards aren't super clear about prescribing devices for sleep apnea. So that's something that you'd have to look up individually.
Okay. And I would like to ask you about combination therapy. I know we discussed it earlier behind the scene, but I want to know what's your experience as a company using eXciteOSA with the CPAP, eXciteOSA with oral appliance, eXciteOSA with myofunctional therapy. I ask 3 questions all at once because I want you to give us overview.
Okay. Well, so if you're using a CPAP for your obstructive sleep apnea, it's important that you continue that therapy during the 6 weeks that you're using eXciteOSA. And you should never discontinue your CPAP until your provider has told you that you can. So it's not something that you should just decide not to use on your own. We have not done any clinical trials looking at combination therapy with CPAP or any oral appliances. However, anecdotally, we do know that providers are prescribing oral appliances and eXciteOSA just to get almost complete coverage, if you will. Oral appliances can help with the apneas very well. In some cases, the eXciteOSA may clear up whatever residual snore there is. So it is often used in combination, but we don't have any clinical data to share with you about the outcomes of combining both therapies.
I really hope with more spread or use of this device, we would get the data about oral appliance and eXciteOSA. So tell me, what about eXciteOSA and myofunctional therapy?
We have a lot of interest from the myofunctional therapy community. We attend conferences that are attended as well by sleep dentists, sleep physicians, and myofunctional therapists. And there is a lot of interest in the therapy. It's different in that the patient's really not exerting the effort and probably not taking as much time as it would take to do a full run of myofunctional therapy exercises for sleep apnea. But the two are often compared. They're often compared.
And very common question from our patients: what are the side effects of this therapy?
Yes, as with any type of medication or therapy, there can be side effects. The ones that we saw in our clinical trials involved only 15% of the participants. The most common side effect reported was pooling saliva, meaning that there was excess saliva during the therapy that the patient had. And that's common whenever you have any foreign body in your mouth. Even when you brush your teeth, your salivary glands respond by producing more saliva. The same is true with eXciteOSA. However, it tends to taper off during the 6-week period. And once the device is removed from the mouth, the side effect goes away. There have also been, in that trial that I mentioned, there were also some patients that said that they had some tooth sensitivity, some tongue tingling. A couple had metallic taste again, but the numbers are small. The adverse effects are mild and they're transient.
And I would like to ask you how often the patient have to replace the mouthpiece.
Right. So the mouthpiece does have to be replaced every 90 days. That is based on the length of use, not the number of uses for the device. And that is right from the FDA. That's a mandate from them. So within the app, you will be reminded 3 times to replace your mouthpiece, once at day 70, day 80, and day 88.
Oh, we lost you a little bit.
Oh, I'm not sure.
I think it was just slow. But that piece, the patient can buy from the company directly or through the provider they got the device from.
So we don't sell direct to patient currently. We sell through distributors. We use durable medical equipment, and we also have some physician offices and dental offices that sell eXciteOSA. So I would say the easiest route would probably to go back where you purchased your device to get your replacement mouthpieces.
So we're very excited to see the results, how this adventure, gonna play. And I have a lot of patients in my practice who would probably benefit from eXciteOSA. I really like what technology become user friendly, what you can use it with the phone, and it's all make this very multi-level difficult disease a little bit, I would say, a little bit easier to approach. We have another question from the user about the mouthpiece. Thank you very much not from the user, from our audience. We really appreciate the questions. And what happened after 90 days?
Yes, the mouthpiece will not work after 90 days. So yes, it will shut off.
Since it's a FDA law, so you have to incorporate that in the device. So we all looking forward to know about more research, and I really hope we will know more about combination therapy with the device.
Yes, we have clinical trials that are ongoing. So we hope to have some of that data published within this year.
Oh, thank you very much, Lori. We're really honored to interview you on our channel. And again, we appreciate our audience who've been so interested in your device, and we got a lot of questions. Thank you very much for that. We really appreciate that. It's going to make us see the picture more clear, and we can recommend it to our patients. And if you still have questions for Lori, if you're listening to this interview in the recording, you can put your questions in the comments, and Lori will find the answer for you.
I will. I'd like to say thank you very much for having me. It's been a pleasure.
Absolutely. Thank you.